Life doesn't stop when the workday ends. On True HR Beyond the Office, Shannon Clark Johnston tackles topics that affect our lives in and out of the workplace, with conversations on mental health, reinvention, self-empowerment, and more. We share actionable insights to inspire meaningful growth. Join us for candid insights and guidance to help you build resilience, create balance, and thrive with confidence in all areas of your life.
Today on True HR Beyond the Office, we're diving into how you can take control of your healthcare choices and make sense of a system that often feels overwhelming. Joining us to help navigate this topic today is Lindsay Humphries. With over 18 years of experience, Lindsay is a forward-thinking benefits consultant with a talent for simplifying healthcare. In addition to benefits consulting, she's worked in human resources services and talent acquisition. Prior to her role at Alera Group, Lindsay led teams at ADP, helping clients streamline operations, reduce costs, retain top talent, and stay compliant. Lindsay's expertise is invaluable to any organization looking to create a meaningful and sustainable benefits strategy. So whether you're an HR professional looking to better support employees or just trying to make smarter healthcare decisions, this episode is packed with insights to help you cut through the noise and make benefits work for you. So welcome, Lindsay.
Thanks, Shannon. I'm really excited to be here.
Well, we're happy to have you. And one of the things, I've known you for some time, and one of the things I think is really interesting about your career, and we talk about this on True HR Beyond the Office, is how you've kind of done these mini reinventions for yourself. So you mentioned I mentioned you were in talent acquisition, you've done sales work at ADP, working in human resources services. So there's certainly common threads there, but you've made these pivots in your career, which is really interesting. So could you share a little bit about that journey you've taken so far?
Yeah, I think it's so important in today's day and age that you do focus on reinventing yourself. Of course, I've always stayed in the HR space for almost 20 years, which is difficult to say. But I think each path in my journey and each stop has been so important to really get me to the place where I am today, to really feel confident, to have a holistic view beyond just one area, one company, or one expertise.
Yeah. So it's more or less, it's not like you're completely changing. You're viewing these as sort of, let's say, stepping stones or building blocks, if you will.
Absolutely.
Yeah.
Absolutely.
So that's all brought you full circle to where you are now in benefits,
Yes.
the wonderful benefits space.
And I should have done this 10 years ago. I absolutely love it.
Really?
Yeah.
Tell me a little bit about that. What is it that's sort of different for you in this space?
I just love the world of benefits, mostly because it's so complex, challenging, and thought-provoking, and changes every day. Mm-hmm. You have to constantly stay up on legislation, compliance, and it just gets me out of bed every morning, so excited to go tackle the next problem.
Yeah, there's nothing like a good compliance issue to get you.
Yeah, I know. I sound like a nerd, right?
Well, I'm glad somebody likes it.
Yeah.
And it's funny because when we were talking about you coming on, I said, well, like, where do you want to go with this? And you brought up your fresh perspective, and you said, I have a lot of thoughts because you're sort of like what we used to talk about in human resources. You're like the new hire who comes in and goes, why do you do it like this? And why don't you try doing it like that? So in terms of this, kind of consumer, I don't know if it's advocacy necessarily, but sort of helping consumers get what they need to make the right decisions. Why do you think, based on your fresh perspective, people feel so overwhelmed?
I think people feel so overwhelmed due to the lack of data, but more importantly, accessibility to that data. I think we're so undereducated as consumers as it relates to healthcare. And the more time I spend in delving into the benefits world, it is just more and more apparent, unfortunately, how broken the system is.
Yeah.
And I think, I don't know, I even go back to the basics of consumerism, right? You think of quality, service, and cost. You can never have all three things when you think of any product in this world that you buy, right? If it's high quality, if you're buying a Mercedes, it's going to cost you a lot and you're going to get great service.
Right.
You can apply that to any product in the world, but when it comes to healthcare, that equation doesn't apply. You can pay a lot for bad service, bad outcomes, really low quality.
Interesting.
So it's such, when I think of it in those terms, it's just so clear that it's so broken and we have so far to go. I think there's some bright spots that we can definitely chat more about, but it's very eye-opening as you really dig in.
No, that's a very good point. I think sometimes you just don't even know what you're buying. You don't know how to know, which is really the point of this conversation. You don't know how to know what you're buying. It's just so funny that this is we're having this conversation today because I was just trying to get copies of a few of the plan documents that I'm being offered. I've had 2 almost hour-long chat conversations with the healthcare carrier. I won't name both times. Just the plan document. I'm not asking for any data of any kind. And they would say they were going to send it by the end of the day. I was literally almost begging the second time, like, just send this to me. I need this information. Never got it. Did an end run around them to a former benefits consultant that I work with and got the information that I needed. So to say that we want consumers to be educated, it's a really interesting comment, because where would someone even start? Right? Like, I can't get documents that exist and probably are sitting on someone's shared drive somewhere. What would we ask for as consumers, or what would we ask if we're, working for, where we have employer subsidized plan? What would we ask our HR department? Where do we start?
It's a great question. I would say, just to go back a couple steps, I think you and I have talked about this before, I just really see that high-deductible health plans are a failed experiment for all the reasons you just mentioned, right? The whole concept was, well, let's shift a little cost onto the consumer, help the employer, and then they'll have some skin in the game, right? But if you have skin in the game, but you have no way to maximize that, it doesn't work. It doesn't work, right? It's a reason I think it's $200 billion of medical debt at the individual level as a country that we have today. So I think, to your point, where do we start? Is I think we're at the beginning of that journey, which is one of those bright spots that I was speaking to earlier. I think that there are more and more solutions, providers, ideas, data that are out there in the marketplace that are specifically driven to help consumers actually understand outcomes. So if you think about today's system, typically, most of the time, you're probably familiar, and a lot of listeners probably are, about a tier system. Everything in healthcare right now, for the most part, is set up on a tiered system. What does tier 1 mean? Right?
Like a tier 1 doctor.
Right. It's a tier 1 doctor. Great.
That sounds good.
The tier 1
One's good.
Right. Exactly.
Number 1.
One is good. It's the best. And the problem with that is that those ratings are based on aggregate data across a physical facility. I mean, think about that.
Yeah.
Again, going back to that quality conversation, we're saying go to anybody in this building and you can get XYZ price.
So that's, I'm going to stop, because I think that's going to shock a lot of people, like your average healthcare consumer.
Yeah.
Because I think the perception is it's a tier 1 doctor who, he or she, has some kind of certification, better outcomes. Like, in your mind, this is a tier 1 doctor. They don't say it's a tier 1 facility that this doctor happens to work in.
Correct.
That's crazy.
So, and that's such a big piece of where, again, me coming into the industry just a couple years in is just been so shocking to me that we actually do a very, very poor job of helping people understand and find good quality doctors. I mean, last time you needed to go to the doctor, how did you find a doctor? What did you do?
I hired a concierge doctor and paid out of pocket.
Okay. That's a whole nother conversation.
I mean, that is another conversation. But no, actually, I did. I did have to find someone recently, and I went onto my healthcare plan, and I searched what was close to me, and I looked at the facility they were at, and picked one.
Right, and the carrier probably pushed the tier 1 providers to the
Absolutely.
top of the search, right?
Top of the search. And then frankly, I was like, I'll go to this doctor, but I'll almost go to any doctor because I didn't want to wait 5 months to see a doctor.
Right. And the other, I would say the second answer I hear all the time is, well, I asked my neighbor because they just got a knee replacement.
Yeah.
Said they liked their doctor.
Right.
Right. And this idea of bedside manner and how your doctor makes you feel doesn't necessarily equate to good quality care. Right. So just because you like your doctor doesn't mean you don't know as the consumer, was that actually the best outcome for my knee? I don't know.
They were nice,
right?
but
You
I
know when
don't
it goes really
know.
bad,
Right.
but you don't know if it could have gone better.
Right.
So what's really interesting is in the market now, there's more and more of a push, which gets me really excited, is to truly dig in and understand data at the provider level. So what I mean by that is actually having at your fingertips, right? This is my dream, in the future, that as a consumer, I can have at my fingertips access to understand which doctors have the best outcomes, also reduce costs, because total cost of care is actually more important than just each, actual visit or episode of care.
And does that data exist right now? I mean, it must.
It does.
So
It does.
why don't we have it now? Who's keeping that?
So there's a lot of different sources and vendors that have that data, and it is accessible, but it's at the employer level, right? Your employer would need to sign into a partnership to get this information.
Okay. So like someone in the marketplace isn't going to be able to get this if they're getting their coverage
Correct.
from the marketplace.
Not today, right?
Not
but
yet.
in a perfect world, I would hope so.
Which is even weirder in a way, because
Yeah.
at an employer's sort of a sense that you don't have a choice, like you're going to take what they're offering you. But if you're out in the marketplace, you're quote unquote shopping for this plan, you don't have access and you're paying yourself.
And you would hope, right? Of course, we would want the government's plans to perform well for the sake of all of us taxpayers, that people are going to good doctors.
Yeah, go to the right one. Don't waste money going to 5 that aren't working. Yeah.
Right. And again, as a consumer, it's scary to think, right? You think of in the area that we're in, if you have cancer, you're going to go to Sloan Kettering, you're going to get the best care, right?
Right.
But you might see the worst doctor in the tri-state just at Sloan. Right?
Because
you don't know.
they happen to be at Sloan and they're in a quote unquote tier 1.
Right. You don't know.
Yeah, I don't think a lot of people know that.
So I think that from my perspective, there are solutions in the market that are doing a much better job of steering folks to these higher quality doctors. And my hope would be the more that we make that data easily accessible is where I think we're not fully there yet. Because ease of use is so important, right? If it's difficult, people are not going to do it.
Yeah.
So I think we have a little ways to go there, but the data is there, and I think what I love about the concept too is not only as consumers our ability to get better health care, but it should have a massive impact on employer plan performance. But also I think it's going to have doctors have to, right, step up their game, because if people are going to know that you're not actually delivering good outcomes, it's going to be unfortunately difficult to be a doctor in that world if you don't really deliver those outcomes. So my hope would be that we weed out, right. Some folks that are not doing their job, but more importantly, that middle chunk of doctors steps up their game.
Well, it's almost like the tenure system, right? For teachers, like once you're in, and there's probably a lot of great teachers that are tenured, but maybe some that aren't. But you can't really know that necessarily until you're in that. Whereas, like you said, you could see a doctor and not really know that they've been having really poor outcomes. Yeah. And you're thinking, well, but this is a Sloan Kettering doctor, just to use Sloan as an example.
Yes.
We don't know. But yeah, it's really interesting because as you're talking about, the high deductible plans, I'm going to date myself now, but I remember when HMOs started becoming a thing. Yep. And I was actually working for an large insurance company at the time, and explaining that, this explanation was managed, right? Like managed. The M was important because you as a consumer were going to start managing. Because it was really like, it wasn't that long ago. I'm not that old. It wasn't that long ago where you didn't even really think about this. It was just something that was done for you. It was through your employer, and that was it. And then all of a sudden this concept of managed care came. But what didn't follow, which I think is a big part of your point, the tools to manage it didn't come. Like, I remember them saying you're going to be negotiating with your doctor on prices and all of this, and I'm thinking, how do I do that?
Right.
Do I just ask that? So and it just seemed to continue, to your point, with the high deductible health plans, which were a little more complex. And it was like, well, and by the way, I agree with you, because every organization where I've led HR, the high deductible plan has always been has the lowest participation rate. And I think it just, people just didn't get it, didn't understand it, and everything else was confusing enough. So that was just the next level.
Yeah, and it's funny that you mentioned HMOs, because I think there's also a bit of a resurgence of this idea of us just letting people go willy-nilly to specialists.
Yeah.
Is that really the best approach to healthcare either?
Right.
Versus the value
Managing,
of actually having, like you said, the concierge doctor, right? Is that idea of having your primary doctor really managing your care, but more importantly, who they refer you to should be data driven, not relationship based.
Right.
Right. And that idea of, have we gone too far with little data to let people go as they please?
It was like they gave up. They were like,
doctors?
okay, we can't really be the gatekeepers anymore. It's too much on the primary doctors, so go wherever you want. But now everyone's going wherever they want.
Yeah.
And it's probably not cost effective.
Yeah.
So
And not the best outcomes.
and not the
either.
best outcomes.
Yeah.
So yeah, when we talk about concierge medicine, and I know that's not your area that you're in more traditional space, but when we initially talked about this, we were talking about cash pay becoming more popular, concierge medicine becoming more popular. Tell me what you know about that in terms of how it may or is impacting traditional healthcare.
So I think what's really interesting when you talk about something like cash pay, and this is when, I kind of get a little pit in my stomach just thinking about, there's so much money in healthcare. It's just being spent in the wrong places. So cash pay is becoming, I wouldn't call it a popular option, but it's something that employers do need to be considering in certain circumstances, because I think the stats are something like 70% of the time it's cheaper if you paid cash than use your insurance for prescription medicine, right? I mean,
Yeah.
I see your reaction, right? The pit in the stomach feeling. It's just the whole idea
I've
of
done
what
it. Yeah.
the whole idea of what insurance is supposed to be
Yeah.
is not what it actually is. It's really not insurance,
Yeah.
right? It's not protecting. What is it protecting you from, right?
What is it? Yeah.
I mean, maybe big catastrophic events, but it's not covering you in your
Yeah.
day-to-day anymore for many people.
Well, and so for my own purposes, but anyone else, so concierge medicine is, when you're hiring a doctor, you're paying him or her out of your pocket, and they're handling your healthcare and so forth. Cash pay, what you're alluding to, I think, is yes, someone has insurance, but they're going to selectively choose to pay cash for certain services. Is that right? Whether it's prescriptions
Well, there's
or
even
something else.
There's even programs now, believe it or not, that employers actually go to that cash pay system where they would just reimburse employees for paying cash for
Got it.
services. In some instances, is cheaper than actually offering health
Wow.
insurance.
And how's that working, though, even if it's not that popular yet? So is that something an employee will just find out in the course of a doctor's appointment that they could pay less? Or is it something that an employer is somehow involved in up front, or is it on the back end?
Yeah, there are programs. An employer would roll out that program
I see,
and
okay.
educate their employees about that option as a way to save money. So to your point, you said you've paid cash
Yes.
for a prescription and realized that, oh my gosh, if I use my insurance, it would actually been more, which
Right.
is wild in some cases.
Right.
Most people don't know that.
Yeah.
I even tell friends,
They don't ask.
Just make sure you ask.
What would that be
there's
if I
too
paid
many,
cash?
There's too many people involved in the procurement process of
Yeah.
pharmaceuticals that it's amazing if you just pay cash and don't use your insurance, you may pay less money.
Yeah, I mean, you're right. I mean, it's a great question. What is it anymore? I mean, I will tell you that I've never, sometimes it's funny. I was making a joke to someone that I've worked in so many different companies and sort of overseen so many different plans. I sometimes get them all confused. But there's been one theme that I know for sure. it's just become more expensive for the average person, whether you're an employee and you have employer subsidized plan, or even in the marketplace. I'm consistently, for example, hitting my deductible. I don't even remember doing that years back, right? And my deductible is much higher than it used to be. The plans are just less rich than they used to be. There are no more Cadillac plans as of, Obamacare and all of that. So I guess what I think you're saying a little bit of is we have to kind of reevaluate the value of these plans, and then how can we make them more valuable to people? Like, how can, if an employer is going to offer a plan and then go, and by the way, here's a cash pay program in case this is cheap. I mean, what are we really saying?
Yeah.
Right.
And I think that's where I do hope this idea of getting quality providers at the forefront of decisions, I think, can make an impact. But if it's not easy and accessible, we have the data. And now I think the next step is really tightening up these different solutions to make it easy, viable for all of us to really get the right health care.
So I have sort of the same question, but two different, I guess, audiences. What kind of questions should HR folks who are responsible for oversight of their plans, what should they be asking their healthcare carriers? And what should sort of your average consumer be asking in terms of getting more transparency? It's like, for example, I remember when wellness started to become a big thing. Again, I'm dating myself here. And it was almost like a point of negotiation with the carrier. We would say, like, well, will you give us $30,000 towards wellness programs? And they'll, defray. It was probably just a chess game of moving money around, but it felt like we were negotiating it. Is that maybe what an HR person should be doing now, and saying, look, I want more transparency for my employees. I want you to do X, Y, Z. And if so, what should they be asking?
So I think, again, I'm going to keep saying it. I think the more that we ask and demand for data around quality and outcome of care, whether you're talking to a carrier or you're talking to various vendors,
doctors, are you saying?
So you're as if you're an employer, right? Asking your carrier what options they have to steer employers to true high-quality providers.
Okay.
Because more and more carriers, some more than others, are leaning into that idea and coming up with different solutions that are in the market.
Right.
Some newer than others, but they're all realizing that they have to get in. I would say from a vendor perspective, it's the same idea. I was chatting with another vendor, recently, who will remain unnamed, but, an AI solution. And everything they put forth seems really great, but I just kept going back to the fact of, if you're driving employees and consumers to a low-cost option, what's the quality component of that, right? How are you determining outside of cost?
Tier one.
Or who you're sending them to? Because if you're just sending them to the cheapest option, one, that's not good for the consumer necessarily. It might be, but we don't know. And then, is that really what's good for the health plan? Because if you keep sending them to the cheapest option, but it happens to be the provider with the worst outcomes,
it's not really even the cheapest option then, really.
It's not the cheapest option at all. It's not right? Because again, going back to that idea of total cost of care. So I think just asking those second and third level questions right now, and really pushing, whether it's your benefit consultant, your carrier, your vendors, asking those questions. Like I said, there's no perfect answer right now, but I think the more we ask those questions and demand it, the marketplace will have to start to catch up. And I've found, again, being, somewhat fresh in the industry, that once you see this, you can't unsee it.
You can't unsee it. And you're like, wait, I need to keep asking the same question because I'm not getting the right answer here.
Yeah.
Well, and if an average consumer calls, let's say, their health care carrier directly, or is it their doctor they ask? This could be kind of awkward, but they say, what are your outcomes? Is there something that your average person can even try to get? If I called up my healthcare carrier right now and said, look, I want to know, I'm scheduled to see this doctor who's tier 1. What are their outcomes like? Would they even tell me?
Yeah, I think at this point, there's nothing like that I'm aware of. New things come out every day. everything.
So it's like Yelp. We got to go to Yelp or Google reviews.
Well,
is this doctor any good?
The one vendor I mentioned, they said, well, we use consumer reviews to drive quality. And it goes back to like what I said, just because your neighbor thought they had great bedside manner, we shouldn't be using that as a way to drive people to certain providers.
Right.
We need to use data and analytics, outcome-based information to drive people to better health outcomes.
Do you think that there's some of it is related to kind of the cultural norm of thinking all the doctors know all the things, and like, yes, I'm not going to ask that question, it seems rude, or obviously they know what they're doing, they went to med school? Is that like something to be overcome in this process?
I think if we can get this data in consumers' hands, it empowers them.
Yeah, 100%.
Right, it empowers them to not feel so, I agree, sometimes insecure when you're trying to navigate the healthcare system, whether it's for your child or for you or whatever the situation may be, or an elder parent. I find myself in that situation where I had something with my son, and I just remember thinking, how do I know who to trust?
You feel helpless.
I talked to 3 different doctors, and they all were telling me different things. How do you know who to follow?
Right.
If I had this data in my hands, think how differently you would feel. You wouldn't necessarily have to go to 3 or 4 different doctors, because you would know you're going to somebody who is going to give you the best results, and you'd feel a lot more confident in care and outcomes and treatment, and and the list goes on. So I think getting that data in people's hands is going to be so critical to overcome that inferiority complex I think people feel with doctors. I know I've felt it.
I think so. And I feel like it's just you're just supposed to take what they say at face value. And I think maybe part of it that's good is, I guess I would call it sort of the social media of it all. It's that everything is more transparent and out there for, whether it is a Google review or even a Yelp, I do look at doctor reviews. I don't know how, reliable they are.
It's better than nothing.
But it's better than nothing.
It's all you have right now.
Exactly.
Right.
So this has been great. I wanted to end with a couple of tips. If you have 1 or 2 tips for folks that are trying to navigate the landscape, what they should be looking for, what they should be asking, from your perspective as this, fresh perspective, kind of, what should they be looking for, or what questions should they ask?
Yeah, I mean, not to sound too redundant, but quality. Yeah. Anything that you can do if you're accessing the healthcare system, dealing with your employer, a health advocate as an employee, or, as an employer, just asking those questions, right? As a employee, when you're calling your health advocate, if your employer provides one, asking those questions. How are you determining who the best doctor is? What data do you have available for me to understand actually outcome and quality-based care? So the more you can just lean into quality, regardless of your role, I think hopefully we can all start demanding better.
Yeah, it's really, I appreciate that. And I think it's a really good point, because I don't think enough people are asking, and I think that they need to be asking. And instead of just what's closest to me, what's within a few miles of me.
Right.
But I think it's also, to be fair, it's the data's not out there, and we're having this assumption that yes, these doctors know all the things, and maybe they do, but maybe some know more things.
And my hope would be that if we sit down and have this conversation this time next year, there'll be a lot more solutions that are easily accessible to the American public,
right,
to be able to impact their health.
Yeah, I hope so too. I hope more people start asking these questions, because they're really good questions. I appreciate all this. Lindsay, before we wrap up, where can people find you if they want more information, or Alera Group? Is there a website that they can go to and check you out?
Yeah, absolutely. So email is always best for me, lindsay.humphries@aleragroup.com, and aleragroup.com is our website. And of course, I'm out there on LinkedIn, so please reach out, connect, and I'd love to hear from you.
Great. Thank you so much, Lindsay. That's it. We're out. Thank you.
Thanks for tuning in to True HR Beyond the Office. We hope today's episode inspired new ways for you to find fulfillment and purpose in your personal and professional life. If you found value in our conversation, let's keep it going. Follow us on social media and visit us at ShannonClarkJohnston.com to explore free tools, resources, and more about our speaking, coaching, and consulting services.